I'm Neil O'Grady, osteopath, and today I'm going to talk about the bony anatomy and landmarking of the elbow. Okay, so first we'll bring the shoulder into extension to about 90 degrees and the elbow into about 90 degrees of flexion. So first, the landmark that I'll put my thumb on here is the medial epicondyle of the humerus. This is pretty easy to find on people. It's larger than the lateral epicondyle. I start here and I'll work my way up the supracondylar ridge of the medial supracondylar ridge up here like that, and I can work my way back down onto that medial epicondyle. I'll work across then next to the olecranon, okay, of the ulna, and when the elbow is in 90 degrees of flexion, that approximately forms an isosceles triangle across here between the medial and lateral epicondyle and the olecranon. So I'll work my way down the olecranon border of the ulna all the way down here to the styloid process of the ulna. And then I'll work my way back up here onto the olecranon, and from here I'm in the olecranon fossa. So fossa being like a hole. So I bring the elbow into slight extension. If I bring it into full extension, it'll fill the fossa, so I can't palpate it. If I bring it into too much extension, the triceps tendon, which comes over here, will be too taut, and when I press on it I won't be able to get into it. So what's in here is primarily a little bit of fat and the tendon of the triceps muscle, which attaches on here, which is quite thin. So I can have it in slight extension, I can press her in here, and I'm in the olecranon fossa. Okay, next from here we're going to move over here onto the lateral epicondyle of the humerus, and I can travel up here along the lateral supracondylar line or ridge along here, and I can work my way back down again onto this, and from here I'm going to swing around. I'll bring the arm back into neutral but the elbow into 90 degrees of flexion, and I'm here on the lateral epicondyle, and I'm going from here, that's the capitulum here, onto the radial head. Okay, the radial head is a pivot joint, so it's like a wheel, so the radioulnar joint is here. I can hold the distal aspect of the radius and ulna and pronate and supinate the forearm so that I can feel that I'm on the radial head. Alright, from here I'll bring the elbow back into to keep the elbow 90 degrees and bring the shoulder into 90 degrees of extension, and here I'm back on the medial epicondyle, and what we're looking for here now is the ulnar nerve. So this will be termed your funny bone by people, and when you get that, you hit your elbow and you get that little dart or tingle into your pinky finger, your small finger, and maybe half of your fourth, that's your ulnar nerve. So I'll drop about 45 degrees inferior and lateral in here onto the ulnar nerve, and it's kind of a thick tubular nerve. You can almost displace it from this little channel here. You can trace it up here like that, and when you're on an actual person, they'll certainly feel it. So be tender, don't press too hard. I go from here then back onto so bring the arm back down from here, I go from here actually onto the medial collateral ligament. The medial collateral ligament, working from the medial epicondyle, will go from here and across to this point here and this point here. So it'll both go from the medial epicondyle onto the olecranon of the proximal aspect of the ulna. So here and here, like a fan out like that. I work my way across here then onto the lateral collateral ligament, which will go from the lateral epicondyle onto the annular ligament, which is it'll attach to the annular ligament, which is like a skull cap or a beanie that goes around the top of the radial head, and that encircles the radial head and allows it to articulate and keeps it in position as it's rotating pivoting in the radioulnar joint. And lastly, we look at the cubital fossa at the front of the arm, and the cubital fossa is an area, a triangular area, which it's an imaginary line, we'll say, between the medial and lateral epicondyle across here. On the inside, the pronator teres muscle, which goes from the medial epicondyle onto the shaft of the radius here like that, and the brachioradialis, which comes down here like that, okay? So within that you'll have the biceps tendon, and that's very easily palpable because it's thick and hard. All you have to do is get the patient to push up against resistance and it'll pop up. Working medial to the biceps tendon, you've got the brachial artery, and working medially again to the brachial artery, you've got the median nerve. And that is what is encompassed or enclosed inside the cubital fossa in the arm. So that, everybody, is a simple shortened version of landmarking of the elbow joint. If you like the content, please subscribe. Thanks for watching. See you next time.